Welcome, everybody. Thanks for participating in today's webinar. It's the second one, and also the last one in a sequence of two. 2 weeks ago, we had a webinar on mainly focusing on the anterior area. But today's webinar is more on also on the flowable injection technique, but now all for more focusing on the posterior area. There's also a brief part that our presenter and dentist Michal will show about what was discussed 2 weeks ago, just a brief summary and some details that Michal wanted to point out. Definitely the flowable injection technique offers you a quick and easy method to restore teeth in minimal or even a non-invasive way. And this is really something we found it very interesting by a lot of people. So a lot of things are discussed, and so Michal runs his private practice in Poland, in Legnica, and he is specialized in the minimal invasive and digital dentistry. He is an independent dentist and not an employee of Kuraray Dental. About our company in brief, if you didn't follow it last time, we are, as Kuraray Dental, are specialized in dental products and technologies. And we have developed and implemented many technologies in our products. Some examples are light diffusion technology, which we utilize in our composite materials, and a very important proprietary zirconium manufacturing technique to be able to create the benchmark in multi-layered zirconia, being katana. Also our rapid bond technology, what we use in Universal Bond Quick, and not to forget the famous MDP monomer, which we use in our bonding systems and adhesive cement systems. Today is more focusing related to our products on bonding, like Clearfield Universal Bond Quick, and of course the Majesty ES Flow. Clearfield Majesty ES Flow, when we developed it, we focused very much on the mechanical and physical properties of the material, making it a very useful material, as I said, very highly filled and very strong. There are 3 flowabilities, but for the flowable injection technique, mostly the low flow is used, and in posterior area, Michal's also using the super low. So that's the lowest flowability or the highest consistency, just what you how you would like to name it. So today's webinar will take about 60 minutes, maybe a little bit longer, but we hope it's not a problem. We try to do it in 60 minutes, but it's also depending on the amount of questions that you are asking. Regarding today's questions, if you have them, please enter them in the chat, and afterwards Michal will overview it. And also after so beginning of next week, we will send you also questions and answers list based on the questions asked during this webinar. So that's my story so far, and so I will open the virtual floor now for Michal, and please go ahead. Thank you.
Thank you very much, Peter, for introduction. Hello, everyone. I'm happy to have a chance to be here once again and speak a little bit about my work, about my experience with flow injection on the posterior part. So this is the topic of this webinar. It's the second part of flow injection webinars for Kuraray. Today, topic of this webinar is basic and occlusion. I named it like that. I don't know which did you watch previous webinar, but we was talking about indication for this technique, and of course, you know that it was invented for the frontal teeth because patients want to change aesthetic, want to change the smile, and this was a simple way to change the smile and receive a good result. But of course, we can use also flowable composite to prepare full mount reconstruction. But we need to be a master of joint and occlusion. And then we will be able to safely reconstruct the occlusion by increasing vertical dimension and rebuild an anterior and posterior teeth. So if the patient is stable with stable occlusion, we can talk about full mouth rehabilitation. I hope you saw this film last time, but I would like to show you this once again because it's perfect, complete these two began together. And of course, I don't want to speak too much about this, what was last time, but this film connect everything together. And once again, you can see a whole protocol step by step, how it look, how I working with my patients, and will be easier to explain you the details about posterior region. So, I will watch this film once again. I will explain all details during this webinar, how I prepare this. And how receive this result. Of course, this temporary, but how receive this during one visit. And of course, you remember also that this technique has protocol, step by step. What do you need to do? So we need to first start from photo and video documentation. Then is DSD. You can choose what kind of software or application, what do you want to make the smile design. Then is centric variation and occlusion. And this will be a topic of for today, and I will try a little bit explain how to manage with this because we need to design aesthetic, but we need to also check it will be functional in the mouth. So next part is the wax up and mock-up, and now you know that this part is the most important for this technique. Then we have color analysis and flow injection, and the last is polishing mirror effect. Of course, today I don't want to talk about photo and video documentation on DSD and how to plan smiling, how to design the smile, because we was talking about this last time. Now I would like to start from Sierra and occlusion. And of course, during this first visit, you have to make the interview and collect the data from medical and dental interview, because you need to know what is the aim of the patient who come to your office, and you need to know what problems the patient have and how you can manage with these problems and how help your patient. Of course, we collect also other data like dental photography, like X-rays documentation. I also, during this first visit, I want to check the joint. So I always use this Wokabado examination. I also check muscles and movements. If the patient open and close and move on the lateral, and if everything is working fine or there's some problems. So I need to check this. And also during this first visit, I make 3D scans. But all of this information, what you receive from this documentation and this examination will help you to put a diagnosis, because you have a different patient. The patient can be with acceptable function. The patient can be with some dysfunction, or maybe there's a patient with TMD problems. So it's not important what kind of patient do you have. If the patient with TMD, maybe not stable patient, or maybe you have a stable patient. It's not important because you know that you always need to change the patient for the patient who is stable. Of course, you can choose your way. Of course, there's a lot of philosophy how to do this, and a lot of tools how to do this. But the most important thing is to change the patient for the stable patient, because then it's a simple path, simple way, and simple and easier to find the answer for two questions: to change vertical dimension or not to change vertical dimension. And for example, let's talk about the patient where we don't want to change the vertical dimension. So we make the registration in maximum intercuspidal position, MIP. So this initial situation when the patient came to my office and she said that she wants to only change the smile, only frontal upper teeth, and just change the smile. So we prepare, of course, mock-up. And the first thing what I do, how to check this in the mouth, it will be working or not in the mouth. You need to change the function. So I gave the patient articulated paper and just tell her, do what you want. Just try to bite, try to move, touch where you want, go forward, go backward, lateral. And like you see on this video, patient feel right now that something is broken. It's very important to understand for the patient that sometimes you cannot just restore upper teeth and just change just one arch, because like you see on these pictures, there's something broken. Of course, you can say that the layer of this actually was very thin, so it was also bonded with tooth, but believe me, there's a very simple situation. If you have that kind of problems right now, you will be also have this problem in the future, because when we look on this side for this, we will see a lot of mess. The contact between the teeth are everywhere. There's nothing like a guidance, nothing protect our restoration. So it's very important to find a solution to show the patient it will be working or not. I like also these pictures, this initial situation and situation with mock-up. And I like to know making these pictures, taking these pictures, for example, edge to edge when the patient try to bite, and we know that the contact is supposed to be only on the central incisors. But when we see contact on the laterals, I know there is a chance for chipping. So maybe in the future will be a problem. Also, when you look on the lateral movements, you will see there's no guidance on the canine. So the contact is only on the incisor. So there will be also a problem in the future, I think, with chipping. So there's a problem for me and for the patient, because I try to always explain something like that to the patient. Upper and lower arch is something like the lock and the key. If you change the key, you won't open the lock. If you change the lock, the key won't be fit. So it will be a problem. If you change something on the upper arch, you always, maybe not always, but often need to change something also on the lower arch. And in situation when you need to change vertical dimension and register new centriculation, you of course have a lot of tools and a lot of possibilities to do this. And all philosophy of occlusion have their own tools, and you can choose which one you want. But in my practice, I always start from leaf gouge, if we're talking, of course, about stable patient, because it's simple. And of course, this technique have a limitation, and I cannot use this for every patient. I choose patient with only the little wear on the anterior teeth, the patient with full mouth of teeth, and with patient with which doesn't have deep bite. But I started from this technique because it helped me to find or helping me recognize if the patient have any problem with the joint. Of course, if not leaf gouge will be the best choice, I can choose some jig. When I'm talking about jig registration, I can make this like on these pictures from by myself using the composite. But of course, I know that we can use also the Cois the programmer or Lucia jig. It depends from you and depends from what do you want and how long do you want to keep this to the patient mouth. And of course, the most important is to find a repeatable position of the mandible. But nowadays, I changed my protocols because I'm working digitally, and now I'm using something what it's called Mojo. Mojo, it's a tool which allows you to check everything in the patient mouth, and in the normal situation when the patient move forward, make lateral protrusion from the right and for the left. You can also check how the patient open. It's the contact of the between the tooth is proper or not. If he open and close, if he back to the same place, and it is repeatable, because this 4D concept from Mojo is for me something like the missing link to the digital workflow, and I need this workflow for my workflow when I work in digitally. And the best thing is that I know where I am in this situation, and I know what to do and how to get to the place where will be better position for the patient. And this tool allows me to bring function with aesthetic together. So I also can check right now my WhatsApp, digital WhatsApp, and check it will be functional or not, and check everything. If not in digital articulator, but in the arch of the closer of the patient. So that helped me also and allowed me to open vertical dimension and also check how much I would like to open vertical dimension. Of course, it's not so easy, because you need to know what kind of restoration do you want. But this technique saves a lot of laboratory time and improve our protocols, trying to make our restoration long-term successful. So it helped me a lot. But you know, our treatment goals during any kind of restoration, if they have the occlusal stability, is the major aim of our treatment. And we would like to have our mere MIP the same like centric relation, and of course correct vertical dimension. Also, our treatment goal is controlled functional and movements. We're talking about guidance, and also we need to check per function if the patient is glitching or the patient is braxing. So we need to know how to protect our restoration. And of course, I know I don't tell too much about centric relation or occlusion. I try to only explain how I manage with this problem in my clinic, because this webinar is not about occlusion, of course, it's about composite. So it's difficult to say about occlusion during 1 hour, but you know that it's a very important part to check that your restoration, future restoration, will be working in the mouth and can have a chance to stay in the mouth for the long time. But when we back to our protocol, now we should talk about WhatsApp and mockup. And I don't want to speak about this right now because we spoke about this last time. I would like to go straight to the colonize analysis. So it's mean what kind of composite is the best for the posterior area. Of course, I showed this. Research last time, and you know that there's no difference between new flowable composite like Cliffy Majesty S Flow compared to the normal regular composite, which is Cliffy Majesty S2, this aesthetic one. And also, you know, remember this slide which described that this flowable composite is even better than normal aesthetic regular composite. It's more like Cliffy Majesty for posterior region. So like you see, the strength of this composite is enough for the posterior area. But of course, you remember that we have three different density of this composite, and we have high, low, and super low. And we know also from the previous webinar that the properties of the composite, despite from the fillers. If we have a lot of fillers, the composite will be more strength, better for the posterior region, more opaque also. So like you see, the best right here will be this super low flowable composite. And of course, it is the best for the posterior segment. And if we have class 1 or 2 on the posterior teeth, the best choice will be Cliffy Majesty S Flow Super Low. So what is the strategy to restore upper jaw? Of course, we can make normal wax up, normal digital wax up of all teeth. It's something common. It's very simple. You have one model, one silicone index for the injection. But also you can make this wax up. I call this interlip model. It's mean 1 yes, 1 no, when you have to restore only the half of the arch. And this is very important, very crucial information for you, because it will be something what will change your workflow. It will be going faster, simple, more predictable. So if you're working in digital protocol, your dental technician can prepare the digital wax up of all teeth and then just turn off half of an arch, and then you receive something like another wax up with 1 yes, 1 no teeth restored. So it will be the best choice, because this first one, when we have restored all teeth, is for the traditional protocol, when you use wax on the gyps, on the plaster model, and then you receive only one silicone index. But when you use this interlip model, you receive two models, one with all teeth and one with half of the arch. And then we will be receive two silicone index. And it, for me, is the best choice for the upper arch, because on upper arch, it's easy to manage with the tongue, with the saliva, with the cheeks. You can do that. But what is the strategy to restore lower arch? Of course, you have the same chance to do this like that. Restore. You can prepare wax up of all teeth and wax up of half of arch. It's been 1 yes, 1 no. So we have two options, the same like for upper. But in lower jaw is very difficult. Of course, it depends from the patient, but it's very difficult to manage with the tongue, with the saliva, with the cheek, because there's a lot of things which are moved. And sometimes it's difficult to do this. But for me, the best choice in this situation is the wax up of all teeth and the wax up only for anterior section of the lower arch or lower jaw. Because when you restore from first premolar or maybe from canine to canine, it's easy to manage with tongue, manage with saliva. You can do this, so it's not the problem. And then you can need to use, for example, rubber dam and protect other teeth and try to restore them with rubber dam. So it will be help you when you restore this first of all anterior part and then start to restore posterior part. In this situation, you will have two models, but you will have three indexes for the flow injection. And there's two different kind of indexes, because on the anterior part, we have some flexible index. But on the posterior, we have something like the stiff hard index, silicone index. And I will explain you later how to do this, how to prepare this. Of course, you have one more option how to do this. And of course, if you're doing this yourself in your dental practice, because you can in the digital way, you can prepare also the wax up of all teeth and the wax up of anterior teeth and the wax up interlip model for the anterior part. It's in half of the teeth only restored. And in this situation, you will receive 3 models, but 4 indexes. But for me, it's too much. I would like to make the process simple. For me, the third option will be the best. Of course, you remember that we can use the standard tray. If you have this transparent plastic without holes tray, it's good. But you know also how to prepare this when you have metal tray. But for me, it's very important that you will understand how to make this custom tray, individual tray, because it will help you in different and difficult situations. And of course, we start from the model. Some model it can be, of course, be a model of your patient, duplicated by your dental technician, but you need to add some silicone to make a space for the silicone, this transparent silicone for fellow injection, and use something like I call dental vacuum former. And this is something the same like you doing night guards or maybe tray for the bleaching. It's almost the same. You can, of course, use your digital model to prepare something like that. And remember that the plate should be from 1.8 to 2 millimeters. It needs to be hard one. And then when you receive something like that, you just cut this and receive something what we call individual tray for the posterior teeth. You saw this film also on the anterior part, on the upper arch, but it's also the same. Just need to remove this individual, this custom tray from the models and just cut it, and then you can use this to make the silicone index. Okay, and we see something like this. And next step is to make the silicone index for flow injection. Of course, you remember that in nowadays digital era of dentistry, we can produce digital wax up with these tubes, which will be a place for the hole. It will be easier to design this in the software. Just don't make this by your own when you have your silicone index and you need to prepare this holes and you don't be sure what kind of position do you receive this hole. So sometimes it will be helpful, and I make the silicone index right now like that. I use, of course, this adhesive for silicone. It's the same what you use for normal silicone impression. And if you have these tubes, you can just press this to the end, because you will have the proper placement of this individual tray. Just put it to the aqua press. Remember, we use pressure about 30 psi or 2 atmosphere, and after 10 minutes you can remove your silicone index. But this time they will be connected together. There will be one silicone index which is stiff. Of course, you can remove by scalpel overflows and the excesses, and when you remove them, it will be easy to make the holes in the proper way, in the proper place. And of course, you have the burrs for this from my set. But remember, when you make these holes, you need to clean it, because there's a lot of debris, a lot of plastic and silicone inside. So you need to use alcohol and clean it very well, because we don't want to have this inside the silicone index. And check the tip of the composite is fit perfectly. Okay, so in that way, we receive something that I call custom tray, no, silicon index for the posterior part with holes. Of course, in this flow injection set, you have something like the burrs for this. You can use these two burrs to make these holes. And of course, you can also use this normal, traditional, flexual silicon index to restore the posterior part also. But I like to restore only the occlusal part of the teeth. I don't like to restore all teeth by composite, only the occlusal part, like the tabletops. Of course, when you have some caries on the occlusal surface or old filling and you want to remove this, you can do that and restore this in the same time when you want to restore using the flowable composite. It's not the problem. But if you remember from the previous webinar, in the case number 8, I call this, we can use this technique to rebuild the posterior teeth, like a part of the general dentistry, or like a full mouth reconstruction when the tear is worn. So you can choose this also in this situation when you want to treat half, all segment, all part of the arch. And when you want to remove these old fillings, you will receive something like this. And this is not good situation for flow injection. So you need to, first of all, rebuild this teeth and try to make the proper contact, interproximal contact, and try to rebuild proximal, interproximal surface. So use, for example, matrix, and use dental wedge, and use some clamps to do this, some ring, and restore it properly. It will be better, it will be easier, and it will be cleaner. And of course, in my protocol, I always use this bond, because for me is the one who changed everything in my practice, because Cliffy Universal Bond Quick I can use in every dental situation, and I can use in to restore also the teeth using the normal composite. But when we want to restore, for example, class 2 the carie, we need to use this bond. We need to use also some flowable composite, and in this situation I use this super low composite from Cliffy. And of course, I use this Cliffy Majesty S-Flow Universal. It will be something what change my protocol and make it simple. And all materials I have from the same brand, and it will be everything fit together. So it will be easier for me. And now I can restore after restoring the interproximal surface and contact between the teeth. I can restore only the occlusal surface using flowable composite. So this was a part of the general dentistry. But when you want to restore all teeth, for example, also from the buccal area, we need to add some rubber dam and also some dental floss to move the rubber dam in the place and move a little bit gums. And in this situation, we can also use this hard, I say stiff silicone index, because you can cut this and find the proper fit of this silicone index on the teeth. Because you know, sometimes when you have rubber dam, you need to put some strength, some put this some force on the silicone index to keep this on the place, in the proper place. So I like the stiff one to use in this technique. Of course, if we want isolate, we use Teflon tape, but sometimes it's difficult to get between the teeth, and also you can help by dental floss. And sometimes you can put also this Teflon tape under the contact point, because we want to keep it clean. We want to restore only this occlusal area. When we protect other teeth, we can restore, for example, first molar and first premolar, or you can change. You can first of all restore second premolar and then restore first premolar and first molar. It depends from you. Of course, we are itching the same protocol like last time. Rise and dry, and then we can apply a bond, Cliffy Universal Bond Quick. For me, is the simple way because I just need to apply this, leave it for 5 seconds, and just dry it very well. And then I can put my silicone index and inject the composite. Then I need to restore another tooth, this time second premolar, and procedure is the same. First of all, itching. When you want to remove this acid, you can use the surgical tip, because when when your dental assistant come with this section, we remove all this Teflon, and it will be a problem because you need to prepare this once again. So use the surgical tip to remove this acid from the tooth, rinse it, and dry it very well, and then apply another one, Cliffy Universal Bond Quick. And cure this, it depends from the power of your lamp, of your device, for 10 seconds. Apply your silicone index and inject the composite. And you will have restore all teeth with the occlusal surface and also the buccal surface. And this pictures show how it was doing from initial situation to the final situation. Of course, sometimes you can use something like the normal silicone index, and you can cut it like the silicone index for the mock-up. Okay, somebody tells you that will help you to clean it between the teeth, but it's not good for me. I try to not use this kind of silicone index, maybe only on the anterior part when we use the rubber dam, maybe then, but not in the posterior part. Why? Because when you check this, when this flexible silicone index, you can change the dimension. You can change the dimension of the silicone index. When you have this stiff one, you cannot change anything. And when you want to restore posterior area, and sometimes it's difficult to have a proper fit this, you will try to make some force. And when you try to make the force, you can change the shape of the tooth, and also you change contact between the upper arch. And it would be a problem because we design occlusal surface and occlusal contacts. And if you want to have the same contact what you design, and then better will be use this stiff one silicone index. When we want to talk about flow injection technique concept, we always thinking about long-term temporary restoration, like the patient from the film from the beginning. And there's the situation what we have. First of all, we want to restore our anterior part, so we doing flow injection on the anterior part from canine to canine, in this situation from first premolar to first premolar, and then we try to restore posterior part. I use always rubber dam, sorry, I always use rubber dam. It looks like that. If you want to remove this old fillings, of course, prepare this first using the matrix, using wedge rings, and try to make the proper interproximal contact, and then isolate and prepare to restore the teeth. The protocol is, of course, the same. It's nothing new. Now we have restored only 2 teeth, second premolar and second molar, and now prepare to restore another tooth. Sorry, now it's will be restored this first molar. Of course, this temporary restoration, and I know that in the future I will change this for the ceramic, but this also some kind of treatment what we can offer to our patient, because we want to change vertical dimension and change also the contact with the between the teeth, between upper and lower arch. And this technique allows you to transform digital wax up to the mouth in 100% and receive proper morphology, proper shape of the tooth and contact. And once again, I would like to back to the polishing protocol because there was a lot of question about how to do that. So first of all, I would like once again show you this film. Of course, you can do this also on the posterior region, posterior teeth. When you restore, you can use this whole protocol. But on the posterior part, I'm trying to finish this on the diamond paste with nylon brush. I don't use this cotton brush with aluminum oxide, but of course you can also do this. I will explain this once again after this film. But remember, when you use this diamond paste, you need to clean this because the paste will be everywhere between the teeth. So now you can use this nylon brush and remove all diamond paste. And remember, you need to clean it. So you need to rinse, dry, and clean by alcohol before you start using another paste, which is Grigia 2 aluminum oxide with cotton brush. It's very important to prepare a surface for another paste. Okay, and when you are happy from the result, you can use just cotton brush without anything, just clean cotton brush on the dry surface and add some mirror effect. It's some trick that, which help you to receive a very good polish effect. So we start from the Softlex. It's not important what kind of brand you choose, but remember, we don't want to curse one or extra curse. We want some fine, extra fine Softlex because we want to only remove and clean the surface on the of the restoration. So remember, we are working with the speed about 5,000 to 10,000 RPM. It's maximum 10,000 RPM, and we clean this without water, from the motor, from the handpiece, but water to the teeth. You can add water to the teeth, to the surface of the restoration, and then clean this, but don't try to put the water from the handpiece. Then we use this, I use this rubber brush, twist polish composite from Kuraray. For me, this one is one of the best one. I like this blue one because it's something more coarse, more aggressive one, and the gray one is more polished, more delicate, and you can receive a very good result using this rubber brush. And remember, without water, and we are working with speed about 5,000 to 10,000 RPM. And then we use diamond paste. It's not important what kind of paste do you use. With gold wheel brush. And remember, we are working about 10,000 RPM speed. And when the paste is everywhere, you can use celluloid diamond strip to clean and polish the interproximal area and surface. When you remove the paste using, for example, nylon brush, and dry and clean by alcohol, now it's time to use this aluminum oxide paste with the cotton brush. And we also use maximum speed 10,000 RPM. And we want to polish this using this paste, but you remember, the surface needs to be clean. Remove everything using the alcohol and prepare the surface for this paste. Okay, so there's one more trick which we use to restore whole full mount by composite. We use something like the validate, something like the key, and we want to check we restore this property or not. It's not important when you restore only the aesthetic part on the anterior arch, But when you want to restore all teeth and receive the perfect perfect restoration, it's mean perfect. It's mean when you want to receive the same result what you have on the digital wax up, you need to use some keys to check everything was going in right direction. If you, for example, restore this one teeth and you want to try to put this validator to the mouth and you see that it's not fixed, something is some problems with this, you know now that you make mistake and you need to remove this and make this once again, because this mistake will be make another mistakes and everything can change and the contact also can change. So it's very important to use the validators when you restore whole full mouth using composite. And of course, in the situation like this, when we have situation before, we can make some design using SmileCloud, maybe ExoCAD. When you're making outsourcing and you send to the dental lab, you can design this in ExoCAD. And we receive during one visit restoration of all teeth to the patient, and it looks like that. Of course, there's temporary situation, and I know that will change everything once again using ceramic. But this this technique allows you to check occlusion, check also the aesthetic and function. So in one visit, you can change everything. In this situation, when we need to remove some teeth and we need to prepare a temporary bridge, which was also printed, we can restore and we can prepare this everything during one visit and change everything and make this our process simple and faster. So the patient, of course, have other treatment like implant treatment, but we need the time. So we can choose this time for temporary restoration, and the patient can check everything, how it will be working, how it will be function in the mouth, how it will be eating during this whole process when waiting for the implant integration. And of course, we have also situation when we can restore full mouth rehabilitation in the patient who was after the splint therapy. I use Mago appliance. So if the patient is stable, we can restore whole teeth. And of course, all of you want to see how it looks after years. So in this case, we have 4 years observation, and there's a patient on the beginning, 2018, and now 4 years later, you can see how it looks. There's no chipping. I see some recession, so maybe patient has a problem with cleaning and maybe using this not proper. But we also see one more thing on these pictures. We lose vertical dimension, and we see this on the lower arch. And it's very important because now in this situation, I use Tetric Ivoclar BLL. And now I know it's not good composite to restore posterior teeth. More better would be use Clearfield Majesty S Flow super low. If more fillers, more strands, better for the posterior region to restore occlusal surface of the teeth. Because in this situation, it doesn't work. So, of course, I would like to show you how it looks in my practice. So I will show you that's the case when the patient comes to my office, and during 2 visits, we start everything. On the first visit, of course, there's the pictures of initial situation. We make also the interview, medical and dental interview. We collect all data, check everything, and make occlusal registration using the module. So I use this because I would like to check if my diagnosis is correct. If not, I know I need to change my protocol and I need to change my way of treatment. So like you see when you check centriculation, it will change the position. That was on the beginning different position and then change the position. So it means the patient is not stable. Also here you see it starts from the different position and back to the different position. So it's not the same situation. If we have stable patient, it will be working in the same path of the same arch of closure. In this situation was a problem. So I know in this stage of treatment before I started that it will be a temporary restoration, and then we need to prepare this patient for the full mouth rehabilitation using some, for example, some appliance like the spleen therapy, or maybe some curse deprogrammer or physiotherapy, and combine this everything to make this proper restoration. So we prepare digital wax up, and the most important for me information is that my dental technician can use this data from Mojo to design this temporaries, or to design this restoration. Now, of course, there's digital wax up, but we can now check the guidance. Is it proper or not proper, or maybe change something, because we can check this how our future restoration will be working in the mouth, and where will be a contact between the teeth in the mouth. And it will help me to transfer this to the mouth and have a chance to be functional in the mouth, even if it is long-term temporaries. So there's a mock-up during the first visit, so we can check aesthetic. Patient also can check aesthetic, but we also can check the function. And then we start flow injection on the upper arch. So we restore upper arch, and then we can restore lower arch using, of course, in this case, validators. When we have old fillings, and or maybe like in this situation, patient lost old filling, we need to restore this before flow injection. It will be a better solution. So in this situation, we restore first of all the distal interproximal wall, and then prepare to restore whole tooth. Of course, etching, bonding, placing the silicone index, and restore. And that it looks when we move our gingival margin, we move our gums by this dental floss. And I know there will be a lot of overflows. Of course, it's not the problem, because it's easy to clean using diamond burrs or cutters, and you're doing the same, for example, when you want to restore class 5, and it's easy to clean this after injection. But in this way, we receive something like the full mouth rehabilitation, so we can check this how it looks after one visit. And situation before, after, on the scans, on the pictures. Also upper arch and lower arch. Before and after one day. I know there was a lot of information during this short time, and I know maybe we have a lot of questions. I will try to explain this right now, but if you will find some problems in the future, please don't hesitate to find me on the Instagram, because some of you find me on the Instagram and asking questions directly. So if you will have problems, please contact with me, and I will try to explain everything. So thank you very much for this webinar, and hope you enjoyed it. I hope we managed with 1 hour. Yes, Peter?
Yes, you did, absolutely. Yeah, even not even in an hour. So yeah, very good, and thank you, Michael, for giving us very interesting information about this technique. And as we can see, there is a large demand for this technique. A lot of people want to know more about it, mainly focusing definitely on the anterior region, but so it also will open our eyes and see several possibilities to include also the posterior area into it. And I think you gave some very valuable tips on that. So also, sorry?
I hope so that everybody finds something, some tips, some tricks
Yeah,
which will be
it has
helpful.
to be. So I have put some questions in the chat box. I'm not sure if it works for you to see it at this moment. I can also drop in all the questions together to you if you want.
Yes, of course you can send me, but maybe I will try to answer some for some question here.
Oh, here they are all together.
Yeah, okay. The first one I think is this one: to change or to restore the vertical dimension of occlusion on a phasebow, on digital phasebow, is necessary. I don't use phasebow at all in my practice. I just put this to the garbage. I don't use it anymore, so I can use I use something like the Mojo, but I don't call this digital phasebow. I call this something like a digital hinge axis recorder. No, you don't need it. Sometimes just need to give a space, and so you need to give the proper relationship between upper and lower arch to the dental technician, and that's enough. And another, which one is the most suitable for the posterior? If super low has higher filler content than low, which one? For me, super low. It's more filler. It will be better for the posterior part. So the Cliff Majesty S Flow super low. It's better for me in the posterior region. Of course, you can also use this for the anterior region, but sometimes it's too much opaque. So that's the reason why I use this low. Also on the anterior part. To change or to restore the vertical dimension of the occlusion. Okay, it's the same for you. Okay. Okay, so now I see. How do you black out the undercuts? Okay, I don't know in which area do you think and where you want to black this undercuts. But when you want to restore, for example, posterior region, and for example, we restore some molar tooth, we need to first of all restore the contact points, and it's very important. And then you can block under this contact point using Teflon, because when you don't want to restore whole teeth, but only the occlusive surface, it will be easier to clean. Okay, please repeat how to remove excesses approximally and cervically. Okay, I use mostly surgical blade, scalpel number 12C. Of course, sometimes you can use also the burrs, diamond burrs, to remove this, or some cutters. It's not the problem for me. You can use everything. What do you want? What will help you to clean this area? Depends from you. What do you want to use? What shade do you use to create the enamel effect? Thank you. Okay, it's a good question. In fact, because I didn't say nothing about orders technique, because we have something like 3 different techniques for flow injection on the anterior area, and this is a simple one. And the one what we use, I use mostly always. But sometimes if the patient wants something more aesthetic, we can use something like the flow injection with layers and stains. And it's something different. So I didn't say nothing about how to use this and how to do this during this webinar, but of course you can do this. It's something similar to the layer composite technique, but the last layer in enamel you can use using the flowable composite. What shade do you use to create the... okay, this was the same. Okay. Okay, should approximal cavity be built on the same visit than injection for appropriate bonding? Okay, I prefer restore this before injection. because when I would like to have the proper contact when I make design of this new restoration. But sometimes, it happens and you need to restore this just before injection. It's not the problem. You can also do this just before injection using this matrix, using wedge and ring to restore proper interproximal wall. Do you only do this above contact points? I'm also interested in how to remove excess approximately. Okay, I mostly try to do this above contact points, but sometimes, of course, I need to restore whole teeth. That means I don't like to restore whole teeth. I sometimes restore occlusal surface and buccal surface, but never lingual or palatal surface of the tooth. Because when you need to restore whole tooth using composite, maybe like a temporary, okay, but it's like a final restoration, it's not good for me. I prefer using, for example, other solution, like for example, crown on lace overlays from ceramic. It will be better for me solution than composite, or which are restored all tooth, sorry. Will there be a flow ball that flows into the approximate and the tray prevents it? Otherwise, it must be difficult to. Okay, if you prepare a good silicon index, they will try to keep this area clean. It's very important to make the proper wax up, and that is the most the most important part of this technique. Remember, wax up. If you prepare good wax up, and you will have a perfect fit of your silicon index, there will be no problem with cleaning on the interproximal area. Okay, it was. Okay, thanks for a nice presentation. How do you decide which technique should be chosen for the individual patient? It's a difficult situation, but you need to speak with the patient about the aims, what the patient need, and then decide, because sometimes you can restore, sometimes patient doesn't want this mamelon, doesn't want this halo effect, doesn't want this gray on the edge, sometimes just want to have the same color of the teeth. So it's very important to speak with the patient and then decide what kind of technique do you want to use in this situation. Which app do you recommend to use, SmileCloud, or which is easier to use? For me, SmileCloud is the easiest one. And I use this all the time, but it depends what kind of dental situation do you have, because there's also a lot of application. For example, when you have scanner, Medit or FreeShape, you have also in this scanner programs which help you to design a smile. Of course, if you using orthodontic, for example, Invisalign Go, you also have something like that, Smile Architect. You can also compare your design with the ortho and prosto. So it depends what kind of patient do you have, what kind of work do you do, and what appliance do you use. For me, SmileCloud is one of the easiest one, and I use this all the time during the first visit, because I would like to show the patient the result, what we want, what we can receive, how we can change the smile just on the first visit. How much time does it take for you to finish one jaw or one section? Okay, on the beginning, it was about 10 hours to restore upper and lower jaw. It was a lot of time. But now, when I'm using this digital protocol and I'm using this interlip model, believe me, last week I restored 17 teeth, and it take me 3.5 hours. It's very fast, but you need to prepare very well your digital wax up, and you need to plan how do you want to restore using this interlip model. It helps a lot. and you can restore a lot of teeth during, I don't know, one visit, about 4 hours, and everything is done. Okay, how much millimeters can this method fill the teeth? Okay, I always tell myself if I can restore this using the regular composite, yes. So I can do this also using the flowable composite. It's not the problem. Problem sometimes is the contact between the teeth and occlusion. Maybe that is the problem, because sometimes we have some breaks, some chipping, but not some adhesion to the enamel, because mostly we bond to the enamel. And the connection is very good, so we can restore the same like you normally use using regular composite, normal composite. Okay, I think it's all. Yes, Jan, Peter?
Until now, yeah, absolutely, Michael. And as you said, there were quite some questions. So we will also wrap them up and make a full list and put some information on that, and we'll distribute that. And I see there is also a new question on do you also restore the original occlusion with the flow?
Yes. Yes, of course. But it depends from the situation. Sometimes I use this clear field universal also, the regular, when I restore only one teeth, for example. Flowable restoration is only in the situation where I need to restore not one teeth, but I don't know, half of the arch. It's simple for me to use the flowable composite and design this in the digital way.
Yeah, there are obviously a lot of similarities with the paste type materials. What you showed already is that the strength is even higher, the flexural strength of the material, so it's very useful. There is only a big difference, I think, in the main difference is the flowability of the material, and so you have to.
Sometimes it helps. Sometimes it helps.
Sometimes it's easy also that you can deliver it directly from the syringe, and but it's a completely different handling compared to the paste type. If you're used to that one, then you have to really get used to working with the flowable.
Yes, especially when you're making the class 2, I always connect flowable with the normal regular composite, so it's normal for me. Yeah. I use both of them when I want to restore this kind of decay.
But I think nowadays, Michael, is that you say normal composite, but I think nowadays the flowable is more normal for you than the old normal.
Yes, in fact, I'm using this much often than the normal composite, regular composite.
Yes. Okay. There's one question if we will have more courses. So we just before this webinar, Michael, we discussed already something about next plans. So at this point, there's nothing set yet. But yes, we are thinking about doing more, and we will absolutely inform everybody to what we're going to do.
Peter and from you. So everything is depends from Peter and from you. If you want to, just ask Peter, tell the Peter of prepare this course, and I would like to make the hands-on for you. It's not the problem, and also show some more details about this technique and maybe some modification of this technique.
Very good. Sounds like a good plan, Michael. Okay, for everybody in the Netherlands, I wish you all a nice King's Day tomorrow, and all people from other countries, I guess you have to work tomorrow. But Michael, once again, thank you very much for your nice presentations. Also on the IDS where you were, and the last 2 webinars, very good. And thanks so much. And
thank you very much. Thank you very much.
We'll keep in touch. Thanks everybody for watching.
Thank you.
Thank you. Bye-bye.
Bye.